So a lot of patients, one of the things that unfortunately happens is a tooth reaches the end of its useful lifespan for a variety of reasons. Maybe it's got a bad cavity, maybe it's been fractured from some sort of trauma. It could be chewing trauma, it could be getting in a bar fight. We see we see all of them. But regardless, something happens and the tooth has to come out. One thing that we do is we take a 3D X-ray of everybody that we're doing any surgery on whatsoever, because we're three-dimensional people. We're not 2D people. And so by being able to see a patient in 3D, we can see, bone structures, we can see where nerves are, we can see where sinuses are, we can anticipate different things in advance to make the actual process of a tooth removal easier. We get everyone very comfortably numb. We actually use a machine called the wand for anesthetic, which we don't charge for it. It costs me more to use it, but it stresses me out less and it makes the patients less uncomfortable. So to me, it's worth the added expense for the practice to bear, just because it makes the process, which is not a pleasant process for anybody, makes it easier. So we get you very comfortably numb, and then we just use a variety of different instruments to kind of push on the tooth to kind of loosen it, within the bone, and then you just gently lift it out. Most of the time, that's what happens. Sometimes the hole that the tooth is sitting in is smaller than the tooth itself, and there's no path of draw for the tooth to come out. And when that happens, it's like getting a filling. We just have to section the tooth into a couple different pieces and pluck out each one of those roots individually. No big deal. The other thing that we do sometimes after extractions, especially if it's been kind of a chronic long-term infection, is we'll draw some blood from the patient, and we will spin that down in a centrifuge to remove the platelets, and then we put the platelets into the socket, into the wound, and it accelerates healing, because platelets are kind of how we heal. So when we take the patient's own healing factors, concentrate it by like 1,000 times, and then put that into a wound, it does help them heal better.
So there could be different situations. The tooth could have a fracture in it, which just makes the tooth non-restorable, and it would need to be extracted. Sometimes people want to have extractions instead of having root canals done, so they'll have their teeth extracted, or you could just have a large infection that there's no other option but to have the tooth pulled.